That was a tiresome day. What's up, beautiful people? It is Thursday, December 10th. It is nearing the end of week 7 for my nurse residency. Today and tomorrow, I will be in the hospital. So yeah, I'll be getting to give you guys an update on that. I'm just in the lobby in our little apartment complex. It's all Christmassy and stuff. Look at that tree. Anyways, yeah, I'll keep you guys updated. Have a wonderful day. Peace. What's up, guys? So just completed, I guess, Thursday. It's December 10th today. So today was pretty tiresome, not gonna lie. I had 2 patients that I cared for completely. Like, I mean, I did have some help doing turns, but yeah, it was a lot of work. Thankfully, they weren't super critical. I mean, I don't think they would give a resident super critical patients, but my preceptor pretty much just let me do everything. So yeah, that was definitely a huge learning experience. Great time management skills, that's for sure. One of my patients was an elderly woman who was in here for a subdural hemorrhage. So she was in a car accident, had a brain bleed. Also with that, she had fractured C2, which is one of your cervical vertebrae back here in your neck. And then she also had an L1 compression fracture. So yeah, we were managing those. When you turn those patients, you have to have 3 people because you're log rolling them. You have to have somebody supporting the neck. Then you've got somebody doing the hips and shoulders. Then that way you can help move stuff. Managing that was interesting. I learned a lot. One of my clinical educators is also really pushing me, and she gave me sort of case studies on my patients just because I finished my online education way too early. And then the other patient I'd cared for, he was a 26-year-old male that has a stroke. Yeah, it's pretty crazy. He does have some history. His left side was completely flaccid, excuse me. He has sensation everywhere. We started him on enoxaparin today, which is a blood thinner to help prevent blood clots from forming. I also got to help with something really fascinating. So we actually had a patient, wasn't my patient, I didn't care for him, that was in here for COVID and passed away. They had other complications that were pretty severe, and I got to help clean him up and get him ready and presented for the family. So what this involved is this patient was on continuous renal replacement therapy, which is pretty much when your kidneys fail, can't filter your blood. So he had a tube down his jugular vein. It's called a hemodialysis port. So I got to remove all of his lines, and he had 5 chest tubes in, which is crazy. So yeah, I got to remove a hemodialysis catheter, a PICC line, which is inserted in his right forearm, or right bicep, excuse me. And then I got to remove 3 of the 5 chest tubes, which was an experience, man. I've never seen so many chest tubes in somebody, and I've never got to pull one. So that was definitely a learning experience. But yeah, wear a mask because you don't want to end up like him. That was sad, and family came to say goodbye. So yeah, that was today. Crazy day, good day, learned a lot, and I'm gonna continue to keep learning. Peace. What's up, guys? It is Friday, December 11th. Not gonna lie, I am very freaking tired. Yeah, yesterday was a really tiresome day. I honestly don't think I realized how much I was doing, but sure realizing it now at 5:30 a.m. So yeah, anyways, thankfully today is the last day. I think I might have the same patient assignment. I'll be caring for the same 2 patients as yesterday, so that'll be kind of nice. I'll be more familiar with them. So yeah, wish me luck, guys. Have a good day. What's up, beautiful people? It is the end of week 7, and boy, am I feeling it. Today was a really good day. I cared for 2 patients. They were not the same patients that I cared for yesterday. Well, one of them was. The other one was not. This other one was an 86-year-old An 86-year-old gentleman came in with shortness of breath, history of COPD, and pneumonia and some other things. They were COVID negative, and we only cared for him for, I want to say, like 6 hours a day, because in the morning he was busy getting a tracheostomy, so they put a tube in his throat. So they made a little surgical incision right here, and then stuck a tube down there, established a permanent airway. That's why. And then they also pegged him, which is a tube that goes straight into your stomach. It's also known as a G tube. Yeah, gastrostomy tube. They have all sorts of names for them, but yeah, one of them is G tube. One is like gastrojejunectomy tube because it goes into the jejunum, which is a part of the small intestine. Anyways, yeah, so it was interesting. Today was a really good day. Managed again both patients on my own. My preceptor really pushed me, did all the stuff aside from like helping with turns, but it It was really good. I am very tired. It's been a long week. I've learned a lot, and I'm gonna go to bed. So, good night. Don't forget the basics of life. Be kind and do good. Peace.